It's a Wellness Wednesday on SVI Media today, sponsored by Star Valley Health. And today I'm with Bud Clark. Bud is the new chief of Star Valley EMS with Star Valley Health. Bud, we really appreciate you taking some time with us. Welcome to the community. Welcome to the area. Let's get to know you first. Just tell us where you were before becoming the chief of the EMS and maybe some of your background.
Great. Well, thanks for having me. I'm excited to be here in Star Valley and working for Star Valley EMS and running the organization. I came here from Arizona, basically. I am a retired Arizona State Trooper. I did 26 years with them. They sent me to paramedic school, well, a long time ago. You can tell by my hair, but for those of you on the radio, it's gray. So this frost color used to be brown. But anyhow, I did 26 years down there. They sent me through paramedic school in Phoenix, and then I worked as paramedic on and off, whether I was assigned to our air rescue operation at the state police down there. We ran a trooper medic, trooper pilot, and I did rescue. From there, then I went to SWAT, spent time as a SWAT guy, and we need paramedics on the SWAT team, so I treated people there, and I just kept my medic status up all that time, and so been a paramedic since 1989, and with that, then retired in 2013 from the state police, and I went to work for Northern Arizona Healthcare. At Northern Arizona Healthcare, I was the base manager. They own at a flight base, and they own 8 aircraft. They fly Bell 407 helicopters, and they also fly a fixed wing. I was the TUBA base manager, so I worked a flight shift as a critical care flight medic, and then also did all the administrative management stuff.
Again, with Bud Clark, he is the new chief of Star Valley EMS, which is part of Star Valley Health. And well, let's talk about more what it means to be chief. What are some of your day-to-day responsibilities? What do you do when you run Star Valley EMS?
Well, I have obviously all the administrative type things, like, making sure schedules are full and making sure that, we've got coverage and so on and so forth. But I'm also a working chief. So as you heard, I am a paramedic. I'm a critical care paramedic. With that, with all the administrative things that I have, we've got some high aspiration goals, and we're looking to get to that critical care level and right now I'm the only critical care certified medic we have. But the previous director, Chris Tanner, did a great job at preparing the organization to go to critical care. He recognized the need for that, and so do I. And what that is that there's times where we need to get a patient to a higher level of care. And how do we do that? Well, sometimes due to storms and our weather, we can't even get an aircraft in here to get it done. So then we need to do it ourselves because we're going to try. And so I've got a relationship with the YDOT superintendent here. I've got a relationship with the IDOT superintendent over in Idaho, and relationships with the organizations. Eric Day, I just talked to him on the phone. He's the EMS chief over in Idaho Falls, and we'll work to meet them at the line, and the plows will plow the roads for us, and we'll get them to Ermac or get them to wherever we need to go. Sometimes we might take them to Jackson, say they needed to go down to Salt Lake. Then we'll get our way up to Jackson, use the YDOT plows to get us up there, and then we'll meet that flight crew at the Jackson Hole Airport when we can't get a flight in here. Our approach, our IFR approach for the aircraft in here is only down to 800 feet, where it's down to like 300 feet down at Jackson. So sometimes we got to go there, but we're going to do what we can to get your loved ones or get you transferred to the appropriate level care. Patient advocacy is our number one priority, our patient care. And how we treat those patients. Really, it's my goal to progress us, take us forward into that critical care transport level. And then when of course, we're going to continue to do 911 response here, right? And so now you're going to get an ICU level clinician responding to your living room, and that will be able to take care of you. So by us doing critical care transport, I will rotate our clinicians. Sometimes you'll be on the critical care rig doing transfers from facility to facility, and other times what will happen? Well, you'll be responding. You'll be on 911 response. So it will upgrade our. It's really going to beef up the care that you're going to receive. You'll be high level care. That's what's going to happen for all the residents of Star Valley.
I don't think anyone's going to complain with that. Again, we are with Bud Clark with our Wellness Wednesday, sponsored by Star Valley Health. Bud is the new chief of the Star Valley EMS, which is part of Star Valley Health. Bud's clearly something you're passionate about, that you're well knowledgeable about, that you have a lot of training with. Again, welcome to Star Valley. Anything else you wanted to mention here before we close?
Well, I just think I'd like to mention just about the service itself. So we are the only full-time paramedic level service in Star Valley, period, serving all 13 communities. And so what you have is you've got 2 paramedics on each shift that are on duty, ready to respond from the garage. So when you call 911, what happens? We're out the door. Right now, our shoot times out the door are less than 2 minutes.
That's the new chief of the Star Valley EMS, Bud Clark, joining us on a Wellness Wednesday sponsored by Star Valley Health.